Good afternoon. Thank you all for being here with us today. I want to particularly thank Dr. Byers for being back with us today. He's been in the field working very, very hard on COVID-19 and has done a fantastic job, and we're glad to have him stand in today for Dr. Dobbs, who is doing other things that need to be done for the department. As I tried to relay to you yesterday, Mississippi is in a fight for our lives. COVID-19 is an ever-present threat, and we are in the middle of a spike. It is putting a strain on our hospital system. Today, I am going to alert you to what is most likely to become a new order with tighter restrictions on 13 counties that are seeing the greatest risk of spikes in COVID-19. Make no mistake, the risk is present everywhere. The virus is in all of our communities, in all 82 counties, but it is most visible and the most community spread is occurring in the following counties. And I want you to know that the way in which we define these counties are as follows. If you have 200 new cases within the last 14 days, or if in the last 14 days you have an average of 500 cases per 100,000 residents. These counties are Hinds, DeSoto, Harrison, Rankin, Jackson, Washington, Sunflower, Grenada, Madison, Claiborne, Jefferson, Wayne, and Quitman counties. These orders are based off of the greater restrictions that we put in place earlier during COVID-19 in counties like Leake and Scott and Neshoba and Atala, as well as Lauderdale and Wayne counties. I am hopeful that the additional restrictions will have some impact, but I am also hopeful that this will likely serve as a wake-up call to the people, not only in these counties, but in the people across the state. While the spread of the virus is worse in these counties, the spread of the virus is occurring everywhere in our state. Let me tell you what these new orders that would be going into effect the first part of next week may look like. Again, it is being done very similar to the way we did it a month or two ago. These additional measures would include further limits on social gatherings. For instance, a reduction down to no social gatherings of more than 10 indoors or more than 20 outdoors. There would be additional requirements for businesses, although at this time we are not going to propose shutting any businesses down. And in these counties, we would require that all citizens must wear masks when at public gatherings or in a shopping environment. To my fellow Mississippians, please take this as an alarm. Our numbers are getting worse. We need your cooperation. I know that no orders will be effective if we do not have the participation of our people. It is up to all of us. If you live in any corner of our state, please follow the rules that are currently in place. If you live in these counties, please adhere to these additional rules. As Dr. Dobbs and I have said, and Dr. Byers and everyone involved in this effort, the little things can make a difference. Just be smart. Stay safe. Protect your loved ones. We need a shift in our mindset. We need all 3 million Mississippians in their own mind to go back to early April. Go back to mid-April, because those are the risks that we are currently facing. The good news is, I know that if we put our minds to it, that we can do this. We as a state have been through worse. And we know that if we work together, we can overcome this challenge. But make no mistake, it is a challenge that we must work to beat. Thank you all for being with me today, and I'm going to turn it over to Dr. Byers to give us the latest numbers.
Thank you, Governor. Appreciate those words as well. So from the Department of Health, we're reporting an additional 703 cases today, as well as 16 additional deaths. The numbers continue to grow. If we look at the deaths today, 50% of those deaths are among long-term care residents. So we continue to see an impact among our most vulnerable populations. The ground that we had gained with reduction in deaths, just a short time ago, we're starting to see some upswing in the number of deaths now. Just to kind of keep things in perspective of where we are with our numbers, since June 8th, so for about a month now, we've identified an additional approximately 14,000 cases. But if you look at that compared to where we were from the beginning of the outbreak with our first cases in March and move forward to June, we had about 19,000 cases. So you can see that just in this very short time in the last month, we've had a major upswing in the number of cases. The governor's correct. There are counties where we're seeing and have consistently seen a lot of cases and a lot of transmission within those. And if you look at our map that we post on the website, you see that central area of Mississippi really gets highlighted. And those are areas that we've been talking about for quite some time, as well as some additional counties where we're seeing transmission. And even though we're seeing it in those areas, any county is just a group gathering away from large transmission or increased number of cases in a long-term care facility. So we do need to continue to put in place those measures that we've talked about since the very beginning. This is not something that the governor, the Department of Health, or the Emergency Management Association can do on our own. It really takes buy-in from every resident in Mississippi. And there are ways to do things safely. And if we're aware of those and we pay attention to that and we wear a mask when we're out in public, if we avoid getting consistently closer than within 6 feet, you know, we can have an impact on transmission, and we want to continue to do that. Again, we're starting to see more of an impact in our long-term care residents. That's what we wanted to avoid, and we want to protect them. We're starting to see more of an impact in our hospital settings and hospital capacity. That's the pieces that we want to protect. So that's our update for today, Governor. Thank you.
Thank you, Dr. Byers. I'm going to turn it over to Director Michelle, who is back with us today. We're glad to have you back, Director, and the floor is yours.
Good to be back, Governor. Thank you very much. Just really quickly, in the last 2 days alone, we've made PPE pushes to over 90 facilities. Got about 30 more facilities scheduled for delivery tomorrow. So just to show that we are still pushing a very large amounts of PPE out to these facilities that are treating COVID patients and to our healthcare workers that are on the line fighting this fight every day. You were briefed yesterday, just real quick on the Fed deck. I know that Mac briefed you that Governor Reeves requested on July the 7th federal declaration for Tropical Storm Cristobal. We had 3 counties that met thresholds there, so we'll add that to the list of federal declarations we're waiting answer back from FEMA on. And then the April 22nd, 23rd storms, still waiting for FEMA to respond on that one. That's the tornado strikes that we had experienced back in April. Thankfully, the tropics continue to remain pretty quiet, but I want to remind everyone that we are still very early into the hurricane season, and it's still projected to be a dangerous season. It is typical that we see a lot of the storms later in the year, so continue to be vigilant and watch that very closely. And then finally, remind everyone of the very extreme temperatures. We're looking at heat indexes anywhere from 100 to 110 this weekend. Please continue to stay hydrated. Check on those elderly that are sick, that possibly don't have access to air conditioning. Please don't leave your children and pets unattended in locked vehicles. Governor, that's my update, sir.
Thank you, Director Michelle. At this time, I will open the floor to any questions. Ross?
You issuing these mask mandates for 14 counties. These counties are pretty spread out. You said the central Mississippi area. I think Dr. Byers said something about the central Mississippi area. Well, you got DeSoto County, Harrison County. Why not just issue a statewide mask mandate?
That's a great question, Ross, and I appreciate that. As you know, we have, since the beginning of this, believed that the best way in which to manage the situation is to focus on those areas where the most transmission is occurring. We didn't just pick these counties out of the blue. We decided that the right metric that we would put in place is that if you have had at least 200 cases within the last 14 days, because remember, if you've had 200 cases within the last 14 days and you're currently seeing the kind of transmission that we're having, if we don't work very, very hard in those areas, we're going to have more than 200 cases over the next 14 days, and that's what we've got to do to get our R-squared down. That's something that we're working very hard to do. When we look at other counties, there are some with transmission that are occurring, but we don't believe today that you should treat Tishomingo, the town of, exactly the same way you should treat the city of Jackson. If the roles were reversed and if the number of cases on a per capita basis were different, then we would certainly make a different decision. What we know for sure is when there is local buy-in, these additional restrictive measures work. How do we know this for sure? Because we've seen it work. We saw it work in Leake County. We saw it work in Scott County. We saw it work in Neshoba County, in Atala County, in ultimately down in Jasper County. But we also know that what we're seeing with this current wave of new cases, that we're going to have to do some additional restrictions, and we believe that the metrics that we put in place are the right ones at this time. And I will tell you, we've worked very, very closely with the Department of Health on these measures. It gives me no pleasure to have to do this. My goal had been by July 1 that we wouldn't have any executive orders in place in Mississippi. That would be my goal. That was my goal. Unfortunately, because many folks have not been as diligent in the last 45 days as they were, say, in March and April and May, it leads us to having to make this decision. Yes, sir. We'll come right back to you.
Thank you, Governor. Last month when I interviewed Secretary Michael Watson a couple times, he told me there was a bill from the House that allowed temporary disability to apply for those who are vulnerable for COVID, to use that as an excuse for absentee ballot voting. With all that's going on, I didn't see it on your Facebook. Did you approve this bill that gives people who are vulnerable to COVID as an excuse to absentee ballot, voting by mail-in that way? What can you update me on that?
Yeah, so there was an election bill that passed the Mississippi legislature. Senator Branning, as well as Representative Beckett, the two chairmen in those two committees, worked out a compromise legislation. It does allow for some additional allowances for voting in person in the circuit clerk's office, and it does a number of other things. I don't have all of the specifics at the tip of my tongue right this second, but we'll get that information to you. We spent all day Thursday, Friday, Saturday, Sunday, Monday, Tuesday, and yesterday looking at the bills that were before us. We had approximately 40 bills due on Monday, approximately 65 bills due on Tuesday, and 70 bills due on Wednesday. So we had 175 bills, 180 bills due over the last 3 days. And I'll get you the specifics on exactly what the compromise legislation was. I did sign it, and it is law. I do know that.
Back to the 14 counties. Those counties are not islands. So if the virus is spreading as rapidly as the health department is saying, isn't it just a matter of time before those counties around those 14 counties start to see a spike?
I don't think there's any guarantees of that. I do think that everybody in Mississippi should be diligent in the way in which they are going about this. I recommend strongly that if you're not in these 14 counties, if you're in one of the other 68 counties in our state, that if you go into a public place, that if you are in contact with other people, that you do so by maintaining social distancing. Do not get within 6 feet of anyone and wear a mask. That's the safest way to protect yourself and to protect your neighbors. And one of the things that I think that I want to keep reiterating is many people have decided, I believe, that, I'd just soon get the virus and everything will be fine. And for a lot of people who are healthy, that's true. But what you don't know is if you get the virus and then you unknowingly and unwillingly spread it to other people, then that's certainly, and in many cases, that can be spreading it to vulnerable populations, as we were talking about earlier in our nursing home settings, for instance, because what ends up happening is if someone has the virus and doesn't know it, perhaps they come in contact with someone who works in a long-term care facility. As you know, we have tried to pretty consistently test those that are going in and out of nursing homes, but when there are literally 11,000 workers, you can't test every single one of them every single day. But that's how it's getting back in our nursing homes. And if you look at our total number of deaths on a daily basis, for probably 30 days, we had a downward trajectory. That is no longer the case. We have now hit what appears to be the bottom, and we're beginning to tick back up. So,
Dave Elliott with WLOX has a question.
Thank you so much, Renee. Governor, Harrison Jackson County on that tighter restriction list, so everyone down here on the coast is going to need some clarification on exactly, from your perspective, what a social gathering is. 10 indoors, 20 outdoors. How does that impact restaurants, bars, casinos? And kind of a second part to that question, enforcement of those rules rests with whom?
Thank you for the question, Dave. The social gatherings are, I think, self-explanatory. It does not change the current rules we have in place at casinos. It does not change the current rules that we have in place at restaurants. At this time, I don't anticipate it's going to change the rules that we have in place at bars. But I want to warn everyone, the fact of the matter is, if the number of cases continue to grow, then we're going to have to look at additional measures. What this particular executive order will say, and again, this is not going into effect today or tomorrow. It'll be the early first part of next week. But we want people to understand that you should start adhering to these guidelines today. Now, your question about enforcement is a very important one. It is very, very difficult for us to enforce these rules. We have to, and we will continue to try to get more and more buy-in by our local officials. Most of the enforcement of most laws in the state are done by local law enforcement, and we're going to encourage them to help us on the enforcement side. We're going to provide state assets if and when we are requested, but we know that we have very good and very strong law enforcement officers, particularly, Dave, down in your neck of the woods, that are going to help us do this. But the most important enforcement is if individuals in our state will recognize what the guidelines are, recognize what the rules are, recognize what the laws are, and adhere to them. Please choose to wear a mask if you go to the grocery store in these counties. Quite frankly, please choose to wear a mask if you go to the grocery store in any county. We went for literally months never having more than 400 cases in a day. Literally months. Today, as was mentioned, we had over 700. That comes on the heels of day after day of cases, in many instances being well over 500, in some cases even well over 1,000 in a day. We have got to take additional measures or our healthcare system is going to be overwhelmed. We know that. We know that. We need individuals to step up. We also need our hospitals to adhere to the current state law, which asks for and requires them to maintain 25% of their capacity for COVID patients. We do not want to find ourselves in a situation where an individual in Mississippi has the virus, could get better with quality treatment, but they can't get that quality treatment because of the healthcare system being overwhelmed. This is a serious situation. And the difference between this and many items where personal responsibility comes into play is with the spread of a virus, you making a bad decision may not only affect you, it can affect the people that you are around.
Nick Juden with Jackson Free Press has a question.
Hi, Governor. Many school districts are waiting for the expiration of the current order to decide how to approach the coming school year. Now that the heightened restrictions have been being put in place for 13 Mississippi counties, should school districts in those areas plan for a delayed opening or for distance learning?
The Mississippi Department of Health has weeks ago released guidelines on how to safely return to school. I believe they've sent it out to every school district in the state. As you know, just by virtue of the way in which Mississippi has chosen to do public schools, we give great latitude to the local jurisdictions. We give them the ability to make a lot of decisions. I am committed for public schools to reopen in the fall. I do not believe at this time that there is a reason to delay reopening in any county across the state. We are continuing to monitor it. I do think it's important that every school district look at and follow the guidelines as put out by the Department of Health. And I believe if they will do that, which, by the way, there will be continued conversation and continued discussions about extracurricular activities. But I do believe it's critically important that we get our kids back in school so that they do not fall further behind in their educational attainment. Yes, ma'am.
Caleb with Daily Journal has a question.
Yes, I was hoping Dr. Byers might be able to answer a question. This morning at a different event, Dr. Dobbs said that as of yesterday, 5 of the largest hospitals in the state had no available ICU capacity. Is our hospital up here in Tupelo one of them?
We'd have to check with that. I can't tell you that for sure. Certainly we can look at that and see. And you know, right now we haven't been releasing the names of those hospitals with the lower capacity. Certainly that's some discussions that we can have, and I know that we've had that question quite often.
The only thing that I will say, I can't answer that question either. What I can tell you is the health department order that limits the number of elective surgeries that require hospitalization is limited to the central Mississippi and the Hattiesburg metropolitan area. I believe it's Hattiesburg and Laurel, as well as the central Mississippi, and it does not include the northeast part of our state. And while I can't specifically answer your question, I think that probably gives you some indication of what the answer would be. Ross?
Governor, the Madison County School District announced today that they plan to resume in-person classes starting August 17th. Do you agree with that approach, and do you plan to send your kids to the private school they attend this fall?
So I have not seen Madison County Public Schools announcement, and so I don't know all of the details. If they said that they were going to reopen August the 17th, that seems like a reasonable decision to me. I certainly could not criticize that decision at all. We have got to get our kids back in school. We're going to have to do it in a way that is responsible, and we believe that there are ways in which to do that. I have full confidence in in the Madison County School District and most school districts around our state to do that. And yes, I have every intention of my kids being in school this fall.
I think, Dr. Byers, this question is for you. You just said that you gave out some guidelines for school districts to follow. Can you name me what those Department of Health recommendations and guidelines are? Are they like relatable to what the CDC said? Because President Trump called those impractical. Does that sound appropriate to you?
Absolutely, and they are based on the current CDC guidelines, and we'll have to see what changes in those. And certainly we haven't seen any updated guidelines from CDC at this point. But you know, the basic principles are more than likely going to stay in place, and from health department recommendations, those will as well. And you know, it's determining what you can do safely. And one of the things that we've provided to schools is a decision matrix model to determine the safety of an activity based on the number of kids within that activity, whether or not they're able to separate at 6 feet or more, whether or not you can keep them, if they are in closer contact, less than 15 minutes. And you know, there are ways that we want to try to do this safely. Certainly we understand the need to get kids back in and get them educated. But just like under any other circumstances, there are going to be some things that we have to put in place to try to prevent transmission within the school setting. And certainly to not only prevent transmission, but prevent those kids from getting sick and bringing it back to the home, where sometimes these kids live in multi-generational homes, where it can have an impact on those most vulnerable people, even if it doesn't have a severe impact on the child. But you know, things like that, wearing a mask when you can, keeping the kids separated, staggering cafeteria times, those are all basic measures that we encourage schools to look at and to put in place. But again, every school is going to develop their own, and every school district develop their own plan that best fits them based on the general guidance.
So real quick, if I may, Doctor, you said they do resemble the CDC guidelines, but the President of the United States was calling those impractical. Does that seem like mixed messaging to you that might confuse people out there?
Well, and you know, certainly we need to kind of see what the new guidelines would be from CDC and what sort of significant changes. I would doubt that the basic principles for separation, for wearing a mask, for the things that we know to prevent transmission are going to change.
One of the things that I have noticed from hearing from people across Mississippi that have kids is one thing that brings Republicans and Democrats and all Mississippians together is everyone wants their kids to get back in school this fall. That is a goal shared by virtually everyone. What I can say to those parents, we have almost 450,000 kids in schools across Mississippi. What I can say to those parents is if you really want your kids to be back in school this fall, in a classroom, learning, growing, achieving, please do the little things now. Please socially distance in your communities. Please wear a mask. Please help us slow this spread, because if we can slow the spread now, it's going to make it that much easier for us to make the decisions that need to be made to get our kids back in school. We don't want to go from 400 cases a day in the middle of May to 700 cases a day in early July to be at 2,000 cases a day 3 or 4 or 5 weeks from now. We need to do the little things now to say, okay, we're going to go back from a mentality standpoint. We as a state, we as individuals are going to go back. We're going to take our head back to where we were in late March, early April. We're going to not do silly things that put us in a bad position. We're going to make good decisions, and when we make those good decisions, it's going to help us slow the spread of the virus. Renee.
Jack from Clarion Ledger has a question.
Hey, I've got 2 questions real quick. The first one is if there's been any update on the number of lawmakers who have contracted coronavirus?
Yeah, And we may have reported this out earlier, but, you know, we've identified 26 positive at this point. It's certainly possible that there will be additional cases. Our investigation is still ongoing to determine if there are additional cases and if there's
Possibilities where if we were asked, now keep in mind, we're not going to go into a local community unless we're asked to come into a local community to help. Sometimes the sheriffs or the local chiefs may do that. For instance, we were in significant dialogue with our friends on the Mississippi Gulf Coast regarding whether or not they would need help monitoring the beaches, for instance. And at one time they thought that maybe they would, and they ended up not. They ended up deciding that they had ways in which to get more SO personnel to do that. And so I'll turn it over to Director Michelle. I don't know if I missed any of the potential state assets or exactly how that would work.
No, Governor, you're spot on. And again, just to reiterate what the governor said, you know, those assets will go in when those communities or those counties, municipalities ask for those things. We mission assign them and send them where they're needed across the state.
Did not mention the law enforcement personnel at the Department of Marine Resources for obvious reasons. But typically, they would be available and engaged as well to potentially help.
C2 Master with WLBT has a question.
Thanks, Renee. Hey, Governor. Hey, Dr. Byers. You mentioned earlier, Governor, that bars, casinos, and I believe you said restaurants as well would not be affected by these restrictions, but you said that if things got worse, that could be a possibility. Where else would you go at that point? And you mentioned also too that, I know this is kind of a two-parter, but you said there would be some business restrictions mentioned, but you didn't really elaborate. Can you kind of give us some idea, you know, going into next week's executive order, what business owners could expect?
Sure. So just to reiterate, at this point, remember, these are all mirrored after what we did a little over a month and a half ago in those counties that were seeing spikes in the east central part of the state, in Leake County, in Neshoba County, in Atala County, Lauderdale County, et cetera, Newton County as well. We would in these additional orders for businesses, we would not change their ability to operate or function, but we would recommend that they have each of their employees screened at the beginning of their shift. They would be screened to ask questions for every employee as to whether or not they had confirmed cases of COVID or if they'd been in contact with anyone that had definitely had a confirmed case of COVID. We would potentially ask our employers to ask their employees if they have had a fever within the last few days. We would perhaps guarantee that that employees had adequate PPE to wear. Obviously, if we're going to require individuals in those counties to wear a mask, we're also going to require employees in those counties to wear a mask and make sure that the employers can provide that. When it comes to retail businesses, we would, again, require a large number of, we would require face coverings for all customers in retail operations. We would make sure that there was hand sanitizer available to every customer. We would make sure that all retail businesses would maintain every possible effort to ensure there was social distancing occurring in their shops. That's up to 6 feet apart from one customer to the next, et cetera. Again, I have not signed the executive order yet. We are still trying to get the details nailed down. But if you want to go back and look at the order that we had in place back 6 weeks or so ago in Leake and Atala and Neshoba counties, it's going to look very, very, very similar to that for a lot of reasons, one of which is it really helped slow the spread in those communities. The Department of Health did a good job. The local elected officials and the local leadership in those counties did a great job. And so we're going to encourage our local leaders in these counties that I mentioned earlier to help us slow the spread of this virus. Ross?
You answered the question when you did about the 10 indoor, 20 outdoor social gatherings. What exactly kind of gatherings are you targeting in this new executive order?
I think I did answer the question that social gatherings are social gatherings. That is things like gathering indoors for events that have more than 10 people there, that is not in a local business. A social gathering is a gathering of individuals for social purposes. I don't know any other way to describe that. A restaurant or a bar is not a social gathering. A restaurant or a bar is we have specific guidelines in place in restaurants and bars, which are designed to ensure that social distancing occurs. That's the reason we have capacity limits on a restaurant, for instance. And so if you have a restaurant that has a capacity of 100 people, right now they can only have 50 people in that restaurant, which by definition allows for individuals to more properly social distance. Yes, sir.
Thank you. Dr. Byers, I'd like to go back to the school recommendations you put out there. Can you tell me, does it address transportation? How are kids supposed to stay 6 feet apart when they're on a bus, for example, or walking through the crowded hallways? Does it address those specific areas to try to stop the spread?
You know, there's going to be challenges in every aspect of trying to prevent transmission among kids when you get them back into school, and certainly, you know, kids riding on a bus is a concern. You know, one of the things that we do recommend is that the bus driver be masked, that the kids be masked while they're on the bus if they're able to do that, and that the bus driver stay, you know, outside of that 6 feet from the rest of the kids, because, you know, we want to try to limit those exposures, but at the same time you have to get children to school. We would encourage parents and encourage the schools to look at alternative means of transportation. If parents can bring their children to school instead of riding the bus, we know that that's not going to be realistic for every family. If you can walk to school instead, again, that's not going to be realistic for every family. And so we encourage school districts to look at those kinds of things and make some determinations about what can we do to reduce the risk. You're not going to be able to get into a situation where you put a bunch of people in close quarters and limit or zero the risk. So what you have to do is put in place those measures to limit the risk, and for shorter times, and making sure that there are things like mask usage.
Renee?
Joey Barnes with WCBI has a question.
Thank you. I don't know if this question is better for Dr. Byers or Governor Reeves, but
Dr. Byers.
Question on, I'm sorry.
Go ahead.
I was going to ask how, I know we're not at capacity yet with hospitals, but how is the state preparing and or working with rural hospitals? And I'm thinking the extremely smaller hospitals like maybe Knoxville General or Tyler Holmes and Kilmichael. Should there be an overflow need for them to start accepting some COVID patients? What kind of guidance is being given to them, or any type of preparation?
So, you know, we do have folks within the Department of Health that are working with the hospital system to determine that plan of care, so we make sure that capacity is maintained, and so that we make sure that people get the proper care regardless of the need, whether it's COVID related or not, and to maintain that capacity throughout, both with transferring to higher level hospitals, but also when the need is not there at those higher level hospitals anymore, to transfer back down. And those plans are all being looked at right now and being refined, and you know, those will come out sooner rather than later.
Will Strickland with DeSoto Times Tribune has a question.
A question for the governor, another on enforcement of next week's executive order. How will violations be handled by law enforcement officers? Say in one of those 13 counties, an officer is alerted to someone refusing to wear a mask in a shopping center. Will that person be issued a citation or a fine? What does that look like?
Well, thank you for your question. Look, what we're trying to ask Mississippians to do is to recognize the risk that we as a state currently face, and we're asking our local law enforcement teams and officers to help people adhere to these rules and guidelines and just use common sense. You know, local law enforcement is much better off, in my opinion, breaking up groups of 25 or 30 that shouldn't be gathered together, and just breaking them up and asking them to move on, more so than writing tickets or writing fines or things such as that. We've just got to, as a state, realize that we've got challenges. We're stressing our healthcare system, and we need our fellow Mississippians to adhere to the guidelines that are put in place.
Ashley Norwood with MPB has a question. So I'm muting. Dave Elliott with WLX has another question.
Yeah, Governor, legislature approved about $86 million in EP Restore Act projects. You didn't sign that, automatically goes into effect. Does the fact that you didn't sign it indicate that you, what, don't agree with the process, the choice of projects? What was the statement you were trying to make?
Well, I don't think there's any doubt that the process that was utilized, in which basically these projects were determined by negotiations that took place, I believe, behind closed doors between and amongst a few legislators, is not the right way in which to do this, and quite frankly, it's not what general law says should be done on these projects. The goal, my goal with respect to the BP money, and as you know better than most, no one fought harder to make sure that that BP money stayed on the Mississippi Gulf Coast than I did. I believe that that's where the bulk of the damage from the oil spill occurred. That's where the bulk of the money ought to be spent. And so I'm concerned not only about the process, I'm also concerned about many of the individual projects. I noticed, for instance, there were projects in which certain amounts of money went directly to privately held companies, and in some instances there were monies that were allocated for projects that did not even request money through the process that was set up by the legislature to go through the committee that was set up at the Mississippi Development Authority. And so what I would tell you is I allowed the bill to become law because I felt it was very important that the Mississippi Development Authority budget was funded so that we can work on job creation and bringing better and higher paying jobs to our state. We had an announcement earlier today, for instance, from Google that they're going to locate a company in DeSoto County. That's a big deal for Mississippi. Mississippi needs more capital being invested in our state, and I'm excited about that. I believe that many of the projects that were listed, while they may have some benefit, I don't know that they're going to help us in terms of job creation, and so we want to look at every one of those projects, and that's certainly something that I'm going to do personally and make sure that we get money to those projects that make sense long-term for the people of the Gulf Coast, and then we'll determine the other projects whether or not they make sense or not. And so we'll continue that. I would tell you that as with respect to those projects that were funded, this is the beginning of the conversation. It's not the end of the conversation. Renee.
Yeah, going back to Ashley Norwood from MPB.
Hi, Renee.
Yes, Ashley.
Yes, okay, take two. Hi, Governor, this is a question for you. You characterized the redirection of funds for the school recognition program as a pay cut for teachers, but nothing in the bill lowers teachers' salaries. The money for the incentive program was redirected to MAP, which funds districts and teacher salaries. But we're hearing from education professionals who say they fear without redirection of the 26 million that districts would have to cut personnel. So my question is, by vetoing the bonuses of some teachers are a higher priority than the protection of all teacher salaries? Thank you.
Well, thank you for that question. I appreciate the nature of it and how balanced it was. Here's the reality. If 23,157 teachers are entitled under current law to receive additional pay because they have earned it, and that money is not there, that is a pay cut for those 23,157 teachers, any way you look at it. And so if you are having education professionals claim that that money not being in the formula is going to lead to reduction in staff, here's what I would tell you. The MAEP formula was funded at a level that was over $40 million more in FY21 than it was in FY20. Now keep in mind, virtually everyone else in state government took 5 to 10% cuts. 5 to 10% cuts, including the governor's office. And I'm not complaining about that. That's perfectly fine. We're in difficult times. But the reality is, if you use this $26 million to pay 23,157 teachers the money that they are owed, the money that is due to them, you still have over $10 million more in the funding formula that is sent out to the districts. What that means is every single district will get more money in the FY21 budget than they got in the FY20 budget. If they still need to lay people off, that sounds like a management issue to me. It may sound like a priority issue to me, but they will not lay anybody off based upon the amount of money they are receiving from the state of Mississippi.
Nick from Jackson Free Press has another question.
Hi, Governor. You said that in your veto of Senate Bill 2123, that it removes all the protections on the release of certain habitual offenders and violent criminals from prison. But you didn't address the fact that the parole board still has authority to actually release or not release those individuals. Do you not feel like that's enough protection for those individuals to have the opportunity to go before the parole board?
I do not.
A couple questions for Dr. Byers we're getting from viewers. One, is rapid testing being done at long-term care facilities? And if not, what's being done to protect those patients?
So what we're doing from a health department standpoint is we're working with each one of the facilities that has an outbreak. We are providing support for that initial testing of all residents and all employees. We're running those tests at the public health lab. That's not a rapid test, but it's a quick turnaround test. We're getting the results back within a couple of days. And the purpose of that is for a couple of reasons. It's to identify those residents who may be infected early on so that we can get them appropriately isolated and prevent transmission within the facility, but it's also to be able to identify those employees so that we can get them excluded from the nursing home and make sure that they're not a source of transmission for these residents as well. It's very important.
I have another question.
Yes, sir.
Are adults with COVID being put in pediatric beds, and how many pediatric ICU beds, and how many ICU beds do we have left around the state?
I'd have to get that exact number for the ICU capacity in the state. I don't have that with me right now. I know that for some hospitals, they have expanded their ICU capacity, in some cases to include pediatric ICU beds, but I don't have an exact number on that. And that's part of the operations for hospitals to continue to expand their capacity so that they can continue to serve those folks who are the most ill, not only from COVID, but from individuals who need ICU care regardless.
Ross, let me just point out, because I think it's important. On July 8th, on yesterday, we had 187 patients statewide in ICU beds. That is down slightly from the day before where we had 190, but it is up significantly from, say, June the 19th when we had 156. So we've got about 30 to 35 more patients in ICU beds in Mississippi today than we had just a couple of weeks ago. Yes, sir.
Thank you, Governor. I'd just like to go back to the new order real quick. So does it apply to households, like if they have a big party at their own house, is that now banned? And also, what does this mean for churches who have 100 members indoors? Does the new order apply to them in these counties?
It applies to individuals in their homes. It does not apply to churches, as we believe that the government cannot shut down churches. We do believe that the vast majority of churches around the state are maintaining social distancing, and we think that's important. They're doing it in smart ways. I will tell you, at my personal church, which is across the street in downtown Jackson, we came back 3 weeks ago, and the leaders at the church made a decision that that because of the rising number of cases, that the last 2 weeks we haven't had in-person church service, which is unfortunate. But I think we've got to continue to monitor that. But I don't believe the government can shut down churches. I've said that from the beginning. But yes, it does include individuals having parties at their house for sure.
Jackson Attorney Ledger has another question.
Hey, Governor, we know that, time is of the essence in this pandemic. I'd like to know why the executive order goes into effect sometime next week. Why not have it go into effect tomorrow?
That's a great question, Jack. I appreciate that. The reality is when you are making mandates on individuals to do things like wear masks, and when you're making mandates on individual business owners to put guidelines in place for their employees, etc., they need a little bit of a lead time to build up to get that done. I will tell you that it has been our experience that when we come on at 2:30 in the afternoon and tell people that we're going to change the rules for certain counties, what we have seen is most every county and most individuals recognize the seriousness of the situation, and you'll start seeing compliance in the new order before it even goes into effect. And I'm hopeful that we see that in Hinds and Rankin and Madison and these other counties that were mentioned earlier today, and I think that we will. Sometimes it just takes a reminder to our leaders in our local communities of the significance of where we find ourselves, and we'll start getting even better compliance, even better concern. Some would say it's a warning shot. What I would say is it certainly we are in a serious situation, and we need the help and cooperation of Mississippians in every county, but certainly in these counties that I mentioned earlier. Renee.
CJ with WLBT has another question.
Thanks, Renee. Governor, with DPS requiring masks at its driver's license stations, what about a requirement for troopers to wear masks while patrolling the state's 82 counties? We've seen there hasn't been a lot of buy-in with law enforcement agencies on requiring masks of their officers, many saying that they wouldn't do so unless required to by the governor, by you. But because these troopers, reach every part of the state, what are your thoughts on that and what might be coming in the future?
Thank you, CJ. I'll certainly talk with the commissioner about it, but what I would tell you is my experience is that the vast majority of troopers spend a large percentage of their time in their vehicle. They spend time in their vehicle by themselves, and honestly, wearing a mask in your vehicle by yourself is not really protecting yourself or protecting anyone else. I do think that typically if the trooper were to pull someone over, it is certainly they tend to be outside. There is less risk when they are outside. That is very different than if you have 20 or 30 people in a driver's services building indoors where we think those masks need to be on. I will tell you that for those troopers who work at the driver services building, they will be wearing a mask. So not only will the customers be required to do it, the employees will be required to do it as well. So it's really just a matter of the level of risk, and we'll certainly continue to work with the commissioner on that.
Emily with Associated Press has a question.
Great.
Hi, this is a follow-up with Dr. Byers. You mentioned that the investigation into the number of lawmakers is still continuing, and that 26 known cases right now exist. I'm wondering if you could tell me a bit about the condition of the lawmakers that are known to have tested positive. Is anybody hospitalized? Is anybody in serious condition in their own homes but not yet ill enough to go to the hospital?
We have no indication that anyone is required hospitalization or that any of the illnesses have risen to that level of severity.
Yes, sir.
Thank you. Director Michelle, this is a question for you, sir. You stated at the beginning PPE has been pushed to 90 facilities, if I'm correct. Can you, one, give me the next number of how much more is coming out, and can you guarantee that the supply chain is not running low, or what do the numbers look like to know if hospitals will continue to be supplied with this equipment?
Yeah, so right now, so tomorrow we're scheduled to deliver to about 30 more facilities. I don't have the list for the schedule for tomorrow, but it'll be about 30 more that'll go out tomorrow. The PPE supply chain is strong, but we've been working over the last 3 months, as you well know, building that supply chain, and we have it. The challenge that we have is getting that full 21-day complement of Tier 1 and Tier 3 PPE set back, because we continue to have to dig into that a little bit to stay up with the current caseload that we have right now. But I have no concerns about the supply chain. Is very strong, as we anticipated would happen at this point in the game, and the capacity continues to build. So we're not seeing any concerns at my level on the purchases of PPE. I don't see any concerns there.
Dave with WLOX has another question.
Thanks, Renee. Governor, the Department of Employment Security has launched what they call Restart Mississippi. It features an online reporting system for employers to try to prevent improper unemployment payments. And they talk about refusal of work. I keep hearing from casinos and restaurant owners that people are staying home, probably because of the $600 extra a week from the CARES Act. Since that expires July 31st, do you think there's a reality check coming for a lot of people?
Well, I have been pointing out from the beginning that if your employer calls you and says, we are reopening, we want you to come back to work, it is in your best long-term interest to go back to work, because that extra $600 does run out at the end of July, and the maximum payment that you can receive on unemployment in the state is $235 a week. And by the way, if you have been offered your job back under state law, you are no longer eligible for unemployment benefits in the state of Mississippi. And so, again, it's anecdotal. I don't believe that there are large numbers of Mississippians that are doing that, but there are some, and that's and I commend the Employment Security Group for putting out that website. I think it was well done. It was well thought out. It was actually an idea that a lot of good people came together and came up with. And so, but yeah, I think individuals who have an opportunity to get their job back, it would behoove them in the long term to get back to work if possible, but to do so in a safe, responsible way. And if you're in a vulnerable category, I think it's important that you work with your employer to protect yourself and protect your neighbors. Ross.
Question for Dr. Byers. What kind of recommendations has the health department issued to schools regarding after-school activities and athletic events this fall, or do you expect those events to be canceled this fall?
Well, I don't know about canceled, and certainly we are working on some guidance that we're going to provide, and certainly we'll be working closely with the governor's office too on what those additional guidance will be for those activities.
That can be done safely?
Well, you know, anything is a challenge. I think that certainly educating the kids and getting the kids back to school is the priority, and we need to put in place the measures to make sure that that's done safely. I would mirror what the governor said earlier, that for us to be able to move forward with activities around school and in school in general, we have to do those things now to try to prevent the level of transmission that we're seeing.
Renee?
Nick from Jackson Free Press has another question.
Good.
Hi, Governor. While I do appreciate a laconic, what was that? Sorry. While I appreciate a laconic answer, can you give me a little bit more detail about why you don't trust a parole board, which I believe you yourself appoint, to make some of these decisions?
I do trust the parole board to make those decisions when I appoint the 5 members of the parole board. But I currently have 3 years and 5 months left on the current term that I was elected to. I have a maximum of 7 years and 5 months left serving as governor, and I have no idea who is going to be the next governor. That is the reason that we have statutes. Now, keep in mind what we're talking about here. Under the bill that I vetoed, actually under the 2 bills that I vetoed, and by the way, I want to be clear about something. I am a supporter of criminal justice reform. Not only have I been a supporter, I have been a leader on criminal justice reform. In 2014, I led the charge to pass House Bill 585. What I would tell you is we are barely scratching the surface of implementing 585, and we are going to implement it now that we have a new commissioner who understands how to run a prison system. He's going to do great work. And we're going to continue to implement 585 to put our state in a better position. And so I am definitely a supporter of good criminal justice reform. I believe that both Senate Bill 2123 and House Bill 658 just simply went too far. For example, 2123 says that a criminal can get parole if they're convicted of crimes that could get them the death penalty, but rather than getting the death penalty, they're sentenced to life imprisonment. They could be eligible for parole under 2123. Right now, you can become eligible for parole if you are 60 years old unless you're a drug trafficker, a habitual offender, or a violent criminal. 2123 removed those 3 exceptions. I do not believe it is in the public safety best interest of the state of Mississippi to remove those 3 exceptions at this time. Another bill, House Bill 658, currently under Mississippi law, because I believe in second chances, currently under Mississippi law, you can erase 1 felony from your record. It can be expunged. That's called giving someone a second chance. Under the bill that passed the legislature, and by the way, you can also have 1 misdemeanor expunged under existing law. Under the bill that passed the legislature, the 1 misdemeanor stayed the same. You could have 1 misdemeanor expunged, but you could have up to 3 felonies expunged. I believe that's a step too far. Now, again, there are a lot of good people on both sides of the aisle that were for additional criminal justice reform. But my view is these bills went too far, and I'm looking forward to working with those advocates for more and more improvements in our correctional system. We can get back and sit down and get back to the drawing board and develop a plan to pass laws that continue our effort. Where we need more work than anything when it comes to helping those within the system is we've got to do a much better job at reentry. When those individuals that are incarcerated, when it's time for them to get out, when they have served their sentence or they are getting paroled, we as a state have to do a better job making sure those individuals are ready to re-enter society. There was actually a bill that I signed yesterday. It hadn't gotten a lot of press yet, but I signed a bill yesterday to create a position at the Department of Corrections at the deputy commissioner level to oversee reentry. That's a good bill. That makes sense. That is good criminal justice reform. That is a bill that I am for. I signed it into law, and we're going to get that person hired sooner rather than later, I hope. But I have full confidence in Commissioner Kane. He knows what he's doing. He knows how to run a system. And we're going to reduce our prison population, but we're going to do it in a way that does not put public safety at risk. Ross.
Dr. Byers, there was a state lawmaker who tested positive for COVID, and he's writing on Facebook that by his count there are 50 members and not 26 who are positive in the House for COVID-19. Can you confirm that?
I can tell you that we have 26 confirmed positive labs. There may certainly be additional cases.
Could it be as high as 50?
You know, our investigation is still ongoing, but you know, it's likely that there's going to be more cases. We're seeing transmission, and so I can't confirm the 50. I can tell you that I wouldn't be surprised if we see more, but right now we have those 26 confirmed, and that's what's been reported positive labs to the Department of Health.
Do you believe that outbreak originated from the close contact of lawmakers and staff in the Capitol, many of them not wearing masks?
Well, you know, we don't know about the use of masks at this point. That investigation piece is still going on. But when you get people in a group, right, we've seen this before, you can have transmission that occurs when people are interacting closely together. Where it may have started and how it got introduced into the legislature, we don't know that yet.
Ross, it could be as high as 175, because that's how many House and Senate members that we have. Yes, sir.
Thank you. Quick question from a viewer, Governor. In the counties with the order, how do funerals get impacted by the new order? Do funerals apply in the new order?
We have strongly discouraged funerals because of the nature of the fact that individuals that are there are very emotional. They want to hug. And I understand that you know, Mississippians tend to be huggers, and we hug each other, and we really want to love on each other when something really bad's happening. Usually, when someone passes away, that is the case, and so we're strongly discouraging funerals anywhere. Large groups, you're going to see additional spread if you're not careful.
But does this order prohibit funerals in these counties, sir?
It does not. Again, I don't expect it to specifically name funerals, but that is certainly, I would say it's a form of a social gathering, though not one for a good reason.
Is that considered a religious church event that you said you didn't want to restrict?
I do not believe that going to a funeral home for a funeral is a religious event, no. But we don't, again, they're not specifically mentioned in the executive order as the current draft exists. I think that's the last question. I appreciate y'all. I've got to hit another meeting. Appreciate all of you. Please, over the weekend, be smart, be safe, and to all of my fellow Mississippians, God bless.